Hi guys, Dr. Gardner with Backbone Wellness right here in Cincinnati. Okay, so if you know someone who has been suffering with low back pain, please forward or link this to them because today this is a big one. Okay, so today we're going to try to empower you so that you can make an informed decision when it comes to back surgeries. Okay, so in 2010, researchers out of the University of Cincinnati School of Medicine reviewed the records from 1,450 patients in the Ohio Bureau of Workmen's Compensation. Okay, so that database, people have been diagnosed with disc degeneration, disc herniation, or radiculopathy, which is a nerve condition that causes pain or tingling or weakness in your legs. Okay, so half of the patients had surgery, and that fused two or more bones of the lower back together, in hopes of curing lower back pain. The other half, with the exact same problem, had no surgery. 2 years later, only 26% of the people who had this surgery were back to work, compared to 67% of the patients who did not have surgery. They were back to work. Okay. Of the people who had surgeries, 36% had complications, 27% had to have a second surgery within 2 years, and 11 had permanent disability, compared to 2% of the people had permanent disability who didn't have the surgery. And it gets worse. Okay. Researchers found that after the surgery, there was a 41% increase in the use of painkillers. 76% of the cases continued using opioids after surgery. 17 surgical patients died by the end of the study. So you see, the evidence really points to the fact that for many patients, fusion surgeries, which are designed, of course, to get you better, very often they don't work very well. The study's lead author said, quote, lumbar fusion for the diagnosis of disc degeneration, disc herniation, or radiculopathy in a workman's compensation setting is associated with significant increases in disability, opioid use, and prolonged work loss, and poor return to work status, end quote. So we're trying to shout this from the rooftops, folks. Okay, so consider less invasive protocols before you permanently change the body that God gave you. Does that make sense? Okay, thanks guys.